In this session, we expect you to gain an understanding of the regulatory environment in which we operate. You'll be introduced to our compliance program and your responsibilities as they relate to it. As an organization, we must comply with many federal and state laws and regulations. From this slide, you can see the various categories of laws and regulations that are applicable to our organization and the services we provide. To make sure we comply with all the laws and regulations, we developed policies, procedures, and our standards or practices. It's your responsibility to be familiar with the policies and procedures that apply to you and your role within our organization. If you're ever in doubt, it's important that you seek guidance from your supervisor, a member of management, or the compliance officer. Genesee County receives funding for its operations from federal and state programs. This funding can be in the form of contracts, grants, or reimbursement from federal or state healthcare programs such as Medicaid. Both the federal and state governments have laws and enforcement actions aimed at preventing and detecting fraud, waste, and abuse. We'll review the 4 primary laws that address them. These include the Federal and New York State False Claims Act, the Deficit Reduction Act, the Affordable Care Act, and the Whistleblower Act. Let's define fraud, waste, and abuse as they relate to billing for healthcare services such as Medicaid. Fraud is an intentional deception or misrepresentation made by a person with the knowledge that the deception results in unauthorized benefit to themselves or another person. Simply put, a person knows the information is false and knows that the deception could result in unauthorized payment. A common example of fraud is when a person intentionally documents for a service that was never provided and the service is billed. Waste is the mismanagement of resources, including unnecessary costs, because of inefficient or ineffective practices or systems. It can be overutilization of services or other practices that, directly or indirectly, result in unnecessary costs to the healthcare system. Abuse is having practices that are inconsistent with generally accepted business or medical practices. Abuse can occur when services are not medically necessary for the person and the services are billed. The Federal False Claims Act was enacted during the Civil War to combat fraud in government contracts. When the law was passed, and still to this day, the law prohibits persons or businesses from improperly receiving governmental funding for goods or services, and also from abusing or wasting the government funds. The False Claims Act was updated in 1986, and the term knowingly was defined to mean that either a person knew or they should have known that the claim or the statement was false. Under the False Claims Act, it is a crime to knowingly submit a false statement or to cause to be submitted a false statement in order to receive funding from the government. Violations of the False Claims Act can result in some very serious penalties and recoveries of funds. When we hear or read about healthcare providers being charged millions of dollars for Medicaid fraud, it's likely due to these fines and penalties. Additionally, an individual or a business can be criminally prosecuted under the False Claims Act. There was another revision to the Act in 2009. The False Claims Act can be applied when a business or healthcare provider keeps Medicaid funds that they were not entitled to. This is seen as a reverse false claim. New York State enacted its own False Claims Act in 2007. It closely tracks the Federal False Claims Act. Under New York's False Claims Act, it's illegal for an individual or business to knowingly submit a claim to New York State government. Because a portion of Medicaid funding comes from New York State, the False Claims Act is applied in cases of Medicaid fraud. The most concrete example of a false claim occurs when a person submits a claim for a service that was not provided. If a person knowingly documents that a service was provided but it was not and the entity bills it, it's considered a false claim or fraud. Another example occurs when there's a difference between the service that was provided and the service that was billed. This often occurs when the wrong code is used and is referred to as upcoding. Double billing occurs when the same service is billed twice and paid. A false claim occurs when a service is not authorized or ordered by a licensed provider, or when services are not medically necessary. The government encourages individuals to come forward and report misconduct involving false claims. Both the Federal and New York State False Claims Act include whistleblower protections. Under the False Claims Act, there is protection for the relator or the whistleblower that prohibits retaliation against them for reporting. This is referred to as the whistleblower protection. The False Claims Act prohibits discrimination against any employee for taking lawful action under the False Claims Act. We've adopted a whistleblower and non-retaliation policy. Any retaliation against a person who reports noncompliance or raises an issue in good faith is prohibited. There are two other federal laws that address false claims. Under the Patient Protection and Affordable Care Act, a provider must return any overpayment of Medicaid or Medicare funds within 60 days after they have identified the overpayment, or by the date the cost report is due. Under the Fraud Enforcement and Recovery Act of 2009, false claims actions may be taken when a provider does not return a Medicaid or Medicare overpayment, even when there is no false claim. This is referred to as a reverse false claim. In 2006, the federal government enacted the Deficit Reduction Act. This legislation places more emphasis on Medicaid fraud, waste, and abuse detection and prevention. The law requires training and education of employees on the False Claims Act and whistleblower protections. It's important for you to understand that there can be criminal or civil prosecution for a wide range of conduct that leads to the submission of a false claim. Should an employee report in good faith knowledge of an alleged false claim, the employee is protected from retaliation or discrimination for making such a report. The Genesee County Corporate Compliance Plan was originally adopted in 2007 and has been updated accordingly, most recently in March of 2023. It's an organization-wide system that applies to departments, programs, and individuals who work for or are associated with or do business with our affected departments. Our compliance program is based on our commitment as an organization to comply with all applicable laws and regulations by which we're governed, and our commitment to conduct business ethically and with the highest degree of integrity. The Genesee County Corporate Compliance Plan is the framework for our compliance program, and it communicates our commitment to comply with all applicable laws and regulations. The compliance plan defines the 7 required elements of a compliance program and describes how we will carry out each element. The responsibilities of persons who work for or conduct business with us are outlined in the Standards or Code of Conduct, a key document of our compliance program. The Genesee County Corporate Compliance Plan applies to all employees, directors, board members, and contractors and vendors who conduct business with our affected departments. It's designed to prevent, detect, and respond to unethical or illegal behavior, any noncompliance with federal and state laws and regulations under which we're governed, any noncompliance with our policies and procedures, and fraud, waste, and abuse in healthcare programs, such as Medicaid and Medicare. Now let's review the 7 required elements of a compliance program. Element number 1 is the establishment of written policies and procedures. Our policies and procedures are based on the laws and regulations and our own practices. They're intended to provide direction and guidance in carrying out job responsibilities or duties. We expect you to be familiar with the policies and procedures and adhere to them. We're committed to compliance with laws and regulations in our policies and procedures. If you're unsure, it's expected that you would seek guidance from your supervisor or management. It's our expectation that you will report any noncompliance with laws, regulations, and our policies and procedures so that we're able to investigate the issue and prevent further noncompliance. Our Code of Conduct is contained in the Corporate Compliance Plan, which was adopted by the legislature. The Code of Conduct provides guidance on doing the right thing in key areas of risk and may reference key points from various policies and procedures. We realize the Code of Conduct may not address all situations you may face. When you are faced with a situation that's not addressed or something may seem to conflict, we expect you to seek guidance from your supervisor or the compliance officer. It's your responsibility to be familiar with the Code of Conduct and be in compliance. Failure to comply with the standards of conduct and failure to report violations of the standards of conduct will result in disciplinary action. The second element of a compliance program is the oversight. The responsibility for oversight of our compliance program is shared between the compliance officer, the compliance committee, and the legislature. The compliance officer is appointed by the county manager and has the overall responsibility for the day-to-day operation of the compliance program. When noncompliance with laws, regulations, policies and procedures, suspected fraud, waste, and abuse, or illegal or unethical activities are reported or identified, it's the compliance officer's responsibility to ensure that there's a thorough investigation and that appropriate corrective actions are taken. The Compliance Committee works closely with the compliance officer to ensure that the required elements of the compliance program are in place and working effectively. As a committee, they're responsible for ensuring that policies and procedures are current and being followed, and that we're in compliance with the laws and regulations that govern it, and that its policies and procedures and code of conduct are adhered to. Committee members are responsible for identifying risks, initiating efforts to prevent or reduce them, and making sure that corrective actions are taken. Another important element of a compliance program is training and education. The training in compliance starts with the legislature and continues with all levels of affected departmental employees, interns, contractors, and board members. Compliance training is required at orientation and annually thereafter, and additional targeted training may be conducted as risks are identified. Lines of communication describes the ways to report noncompliance. Our open door policy encourages persons to ask questions, seek clarification, and address concerns with management. Any person who is aware of noncompliance is expected to promptly report it to their supervisor, department head, the compliance officer, county manager, assistant county manager, or any member of the compliance committee. A report may be made anonymously by calling the Anonymous Fraud Hotline at 585-815-7830. It's important to provide as much detail as possible when making an anonymous report because the compliance officer will not be able to contact you to obtain more information during the investigation. What should you report? You're obligated as part of your responsibilities in the compliance program to report actual or suspected misconduct that you, in good faith, believe is occurring. This includes actual or potential unethical behavior or activities, illegal behavior or activities, violations of the Code of Conduct or the compliance program, violations of laws and regulations, and violations of our policies and procedures. Additionally, you are also obligated to report any falsification of records or documents, any improper acts involving the delivery or billing of services, suspected fraud, waste, or abuse, any misuse or misappropriation of Genesee County's funds, information, equipment, facilities, or other assets or resources, any act of retaliation or intimidation for reporting concerns or participating in an investigation. Failure to report any of these issues may be determined to be a violation of your obligation to report and a violation of our compliance program. Failure to report may lead to disciplinary action up to and including termination. We've adopted a zero-tolerance policy for any form of retaliation against a person for good faith reporting of actual or suspected noncompliance. The term good faith means that the person has good reason to believe the noncompliance occurred or is occurring. Retaliation must be promptly reported to the compliance officer for investigation. Our policy for disciplinary action addresses what will happen when someone does not follow the Code of Conduct or our policies and procedures. Additionally, the failure to report actual or suspected noncompliance will also result in disciplinary actions. It's noteworthy that disciplinary actions may not always be progressive in nature and may be escalated to more significant discipline depending on the violation. Auditing and monitoring activities are based on identified risk areas. Our audits are designed to test our compliance with laws, regulations, and policies and procedures. The results of audits are shared with the Compliance Committee and Legislature. Risk areas identified in auditing and monitoring are incorporated into the compliance program. If deficiencies are identified from an audit or from monitoring activities, a corrective action plan is developed. Any noncompliance or risk identified as a result of internal auditing and monitoring is thoroughly investigated and a corrective action plan is required. All findings will result in corrective actions, which will be promptly implemented to prevent recurrence. Corrective actions can include training, policy and procedure revision, discipline, self-reporting, and refund of any overpayments. In summary, our compliance program is designed to prevent, detect, and respond to noncompliance and suspected fraud, waste, and abuse. Some key compliance program policies and procedures that you should be familiar with include our standards or code of conduct, whistleblower protections and non-retaliation policy, exclusion screening, False Claims Act, and whistleblower protection policy. You are an important part of our compliance program, and we expect you to become familiar and comply with our code of conduct and our policies and procedures. Promptly report issues of potential fraud, waste, or abuse. Report any retaliation or intimidation, attend all required compliance trainings, and know how to report compliance concerns. Compliance is your responsibility. It's everyone's responsibility. When in doubt, report it. Fraud is intentional. It is a deception or a misrepresentation that one knows or should know to be false. Some examples include purposefully billing for services that were not provided, misrepresenting who provided the service, or submitting a bill for a service that has a higher reimbursement rate than the service that was actually provided. Waste, as it relates to healthcare services, is the overutilization of services or other practices that, when directly or indirectly, result in unnecessary costs to the healthcare system. An example of waste is providing services that are not medically necessary. Abuse includes, but is not limited to, a range of improper behaviors or billing practices. It's similar to fraud, except there is no requirement to prove or demonstrate that the abusive acts were committed knowingly, willfully, or intentionally. Common examples of fraud include billing for a service that was not actually provided, billing for a service when a person was not present. Another example of fraud may be double billing or billing twice for the same service. Billing for services by unqualified staff is another area that poses risk for fraud. Billing for services that are not medically necessary may be considered fraud. It may also be considered fraud if services are not adequately documented or if one or more requirements of the documentation is missing. Coding errors or upcoding may be examples of fraud as well. And inaccurate recording of start and end times when used to establish the billing unit or code may result in fraud. We've put measures in place to identify and prevent these risks, including this training. As part of your responsibilities, you're expected to seek guidance if you're unsure about documentation and billing practices. It's important that you immediately report any indication of these risks of fraud or wrongdoing to your supervisor, a member of management, a member of the compliance committee, or the compliance officer. There are some common risks of fraud and abuse related to coding and billing practices. If you have questions related to the coding and billing of services, seek guidance from your supervisor or the compliance officer. The government does acknowledge innocent errors. In those instances, there are no civil or criminal penalties, but the provider must return any money it received in error and put measures in place so the same error does not occur again. For the government to prosecute, there must be a criminal intent to defraud. In these cases, there are criminal penalties, which may include fines, restitution, and possible jail time. There may be civil penalties in cases where a provider had or should have had knowledge of a false claim, and in cases where the provider disregarded or deliberately ignored the information about a false claim. For an innocent error to be considered, a provider would need to be able to demonstrate that it had adequate internal controls and practices to ensure compliance and prevent fraud. And the provider must have procedures in place that address how funds were received in error and returned or voided. If we identify that we have received payments in error, we have procedures in place for returning over payments or funds we're not entitled to. As a provider of Medicaid services, we agree to abide by certain requirements. This regulation means that the organization, Genesee County, and you, if you're involved in the provision of services, must document services at the same time that the service is provided, or closely afterwards, for all services that are billed to Medicaid. The regulation goes on to say that the organization and you, if you're involved in service provision or billing, agree to only submit claims for services that were actually provided and medically necessary. Any information that relates to a claim for payment must be true, accurate, and complete. In other words, services must be documented accurately, thoroughly, and honestly. As a provider of Medicaid services, we must also comply with all laws, rules, and regulations. We have established standards for reimbursement to prevent fraudulent or erroneous claims. Those involved in the provision and billing of services are expected to adhere to these standards. Claims must only be submitted for medically necessary services provided by eligible providers. All claims must be thoroughly and properly documented and accurately coded. Billing errors must be promptly identified, and any payments received in error must be promptly returned to the payer. We have basic standards for service documentation. All services must be documented in a contemporaneous manner. This means that documentation should be completed as soon as possible after the service is delivered. There are certain required elements of documentation, depending on the service. Basically, all documentation must prove that a service was provided to a specific person on a given date. The documentation must include the service that was provided and the signature and title of the person who provided the service. It is also important that the documentation is permanent and legible. A good rule of thumb is that an outside reviewer must be able to read what you documented and be able to identify the person who provided the documented service. Backdating and predating documents is unacceptable and may be considered a crime under federal and state laws. What if I make a mistake or forget to document? All entries in our records, whether they're service documentation records or billing records, must be permanent and not altered. If there is any error in the record or the record must be amended, it must be done appropriately and legally. The alteration must show the date that the change or alteration was made, the name, signature, and title of the person who altered the document, and, if it's not apparent, the reason for the alteration. If you have questions on how to correct a mistake or add information to a record, you must seek guidance from your supervisor or the compliance officer. Your responsibilities related to service provision, service documentation, and the billing of services includes becoming familiar and complying with the Code of Conduct. You're expected to comply with laws and regulations and our policies and procedures related to service provision, documentation, and billing. You're expected to provide and document services that you provided promptly, accurately, and honestly in our records. You're expected to report problems or mistakes that you see that may lead to inaccurate billing. In accordance with the compliance program, you're expected to promptly report any issues, concerns, or possible violations of law. The Anonymous Fraud Hotline number is 585-815-7830.